So this is going to be just a real quick video on buttonology and the use of the CareFusion Revel ventilator. The Revel ventilator weighs in at 9.5 pounds. That's without the mounting bracket that we use in the aircraft or the critical care ambulance. It's also without the extra bag of equipment that we use with it. The ventilator itself is approved to be used in patients who are greater than 5 kilograms. The ventilator that we use, we have two different circuits, a 15 millimeter circuit, which is approved for between 5 kilograms and less than or equal to 20 kilograms, and then a 22 millimeter circuit, which is approved to be used in patients who are greater than 20 kilograms. When you look at the ventilator, there's three distinct panels to it. There's a control panel, there's an alarm panel, and then a pulse oximetry panel. The pulse oximetry panel we chose not to use. Our patients will be monitored using a monitoring device. The control panel is the area where we will set our breath rate, our inspiratory time, our tidal volume, pressure control if we choose to use that setting, pressure support PEEP, sensitivity. You'll be able to see if the patient takes their own spontaneous effort here. What that light will illuminate. You'll be able to set your FiO2, your breath type, and your breath mode. The alarm panel will be able to see a few different things and also set a few different things. So you'll be able to set your low peak pressure, your high pressure limit, your low FiO2. If you're in a non-invasive positive pressure ventilatory mode, that light will illuminate, and then your low minute volume alarm also. Down below the ventilator here, or in this, down below the pulse oximetry panel here, there's some very important buttons. The first is the on-off, of course. The other is an alarm check, so you can adjust the volume with that and see what it's at. You'll be able to see what power source you are using with this panel right here will illuminate. You can lock the entire thing if you wish by pushing in that button. You can give a manual breath to your patient at any point by pushing in that button. The maneuvers button is a button that we'll talk about a little later on during this video when we want to check plateau pressure or we want to see somebody's auto PEEP. And then of course the all-important yellow silence button. The side of the ventilator has some very important pieces to it also. The first that I'll address is the charging port here. I will say that this tends to be a fairly sensitive piece right here, so please be careful when charging the ventilator or plugging it into external power. The other are inlets that we do not currently use. So one is the ability to monitor FiO2, another is pulse ox, and of course we didn't purchase those options with it. And then here is the portion where I'm going to hook my circuit up, which we'll go through. On this side of the ventilator we have a few different things also. So the first thing is my battery. So I can check my battery's power by pushing in this button and illuminating these lights. If I want to exchange the battery for another one, it's a two-step process. So I'm going to go ahead and pull this switch up, which will jettison the battery somewhat. Then there's also a safety mechanism on the battery here that I have to push in, and that's how I'm going to pull the battery out, and then I can remove it from the ventilator if I wish and exchange it for another one. Also on the side of the ventilator is a couple of very important pieces. So right here is where my high flow oxygen hose is screwed into, or if I choose to use a low pressure setting to deliver flow or oxygen to my patient, I can plug, or screw a Christmas tree into that and use an oxygen extension tubing for that. And then here is where I'm going to go ahead and use oxygen extension tubing to plug into nebulized medication if I wish to use the ventilator. So my circuit is now applied, and at every shift we like to make sure that the circuit is intact and working properly before we do a patient transport. So I'm going to go ahead and do a circuit check at this point. And so to do that, I'm going to go ahead and turn the ventilator on. It's going to give me a couple of alarms here real quick, so external power loss. So I'm going to go ahead and silence that. push it twice to get out of it. It's going to ask me same patient, no, new patient, no. I want to do a vent check, and I'm going to go ahead and select that. It's going to tell me to remove my patient, yes. So I silenced that. Patient ID, no. Language, no. Units, no. Button test, no. I want to do a circuit test, and so I'm going to select that. It's going to give me a countdown, and I'm going to follow the instructions provided by the ventilator to go ahead and do the circuit test. Okay, so now my circuit has passed, and so let's just go ahead and go through how we can set the patient up on the ventilator. So when I turn it on, it's going to ask me same patient or new patient. And for this one, let's go to a new patient. We're going to go ahead and select that. Patient ID is not a parameter that we use very much. The size is. And so when I turn the ventilator on, it gives me 3 distinct sizes: adult, pediatric, and infant. Let's go ahead and start out with an adult, and I'm going to select that, and at this point it'll ask me, is the patient intubated, or do I want to use non-invasive positive pressure ventilation? For a greater discussion on non-invasive positive pressure ventilation, you can reference the YouTube video NPPV, CPAP plus pressure support, and BPAP that's on this channel. This one we're going to go and we're going to do an intubated patient, so we're going to select that. When I pop the intubated patient up, it's going to give me some general settings. So you can see here that I've got a breath rate of 12, an I time of 1, tidal volume of 500, and a PEEP of 6 with an FiO2 of 21% and a sensitivity of 2. I'm currently in a breath type of volume and assist control mode. All the things that are highlighted or bright are what is in play currently. The things that are not highlighted or less vibrant are not currently in play, and so there's my control panel. My alarm panel sets itself initially also. You can see I've got a low peak pressure of 10, I've got a high peak pressure limit of 40, and I've got a low minute volume of 3 currently. If I would like to adjust something, so let's say I want to do a breath rate of 14 breaths per minute, I need to push that, and then I need to adjust it using the scroll knob at the bottom. So I'm going to set it at 14. If I don't push it again, it will set itself back down to 12. So we'll demonstrate that here for 1 second. So after a preset amount of time, it has set itself back down to 12. So for me to get that respiratory rate of 14, I go ahead and push it, I adjust it to 14, and then I push it again to lock it in, and you can see now I'm at 14, 1, 500, 6, 21, and 2. If I want to see, so right now I'm in assist control and a volume mode of ventilation. If I want to see what my plateau pressure is, I'm going to come down here to my maneuvers button. I'm going to push that in. You can see it's blinking right now, and it asks me, do I want an I hold? I'm going to push and hold that in again, and it's going to show me the P-plat there. It's going to go ahead and give me an inspiratory hold, and I've got a plateau pressure currently of 26. If I want to go ahead and see what my auto PEEP is, then I'm going to go ahead and move it over into a pressure control mode of ventilation. So again, it's blinking right there. If I don't push it again and lock it in, then it's going to go back to volume, but I'm going to choose to use pressure control. And you'll see right now that I'm at a breath rate of 14, an I time of 1, a pressure control of 15, with a PEEP of 6, sensitivity 2, and 21%. I want to see what my auto PEEP is, so I'm going to go ahead and push maneuvers again. It's going to ask me if I wanted to do an expiratory hold, and I do, so I'm going to push and hold that in. I'm pushing and holding that, and then letting go, and it'll give me an auto PEEP of 2 at this point. Move it back to a volume mode of ventilation. And so there I am now. So some other features that you will see right now that I have up here, these orange lights that are illuminated, that tells me what my alarms are set at. So you'll see that my high pressure is at 40 and 40, and my low peak pressure is at 10 and 10. I can also trace that up, and it looks like my peak inspiratory pressure is right around 28 or 29. I can use the select button, so I can push that and toggle through my different parameters if I wish. So my expiratory tidal volume, minute ventilation, mean airway pressure, peak inspiratory pressure, and so on. If I want to lock onto one, so say I want to monitor my peak inspiratory pressure, I selected that, I toggled to that, and so I can see that rather than the ventilator going through one by one after a time period. So that is the Revel ventilator, buttonology, anatomy, how to set up the circuit, how to do a circuit test, check the plateau pressure, and the auto peak. For further questions and explanation on the ventilator, please see the other videos. You can also reference the CareFusion manual, and you're also welcome to watch the ventilator management video.